Hey everybody, Dr. Jared Skowron from Spectrum Awakening. There it is, Spectrum Awakening. Hope everybody is having a good time. When I'm in my office, when I'm talking to patients and we're doing telemedicine, everybody's always asking about language. How can we get more language and more speech out of our child? Because it is such a crucial component of autism and of developmental delays, and really just getting as much as we can from our kids, because we want to know, are our kids happy? Are our kids sad? Are they in pain? Are they upset? If so, why? So language and expressive language is so helpful in so many ways. So I want to talk about what I've done in my practice that has helped our kids develop more language. And in some cases, I remember a patient from a few weeks ago, we got like 100 words in 2 months. They had 3 to 5 words, and then boom, 2 months later, we did our work and they had 100 words. So I want to help you guys do that with all your kids. So let's get into language. Now, there are a lot of different ways that can help your child get language. And that is frustrating for many because some people do one thing and get language, and other people try that exact same thing and don't get language. You know, for example, like we talked about last week, the diets are very popular. So for some people, they do the diets, they do gluten-free, they do dairy-free, and their child improves their language, okay? That doesn't work for everybody, all right? Some people will go through different kinds of detox and try detox, and for some people that brings language, for other people it's not so much. Some people will go through different yeast treatments or intestinal treatments, and that brings their child some language, and others not. So, boy, there's so many different things to try. What I wanted to focus on today was what I do that gets me the best results, okay? Because some of our kids do the diets, some of our kids do the yeast treatments, some do the detox, that helps with their language. But I wanted to walk through with you guys really what helps the majority of my kids get language. Not all, because again, nothing works for everybody, but for the majority of my kids, this is what brings about language in them. So we're gonna walk through this, and what I tried to do is make a more concrete protocol for you guys to make this easier. And if you want to check it out, we have a brand new bundle of supplements on our website. So when you go to our website, spectrumawakening.com, you go to products and then you go to bundles. Bundles are products grouped together and sold together because they belong together, but they're also sold at a more affordable price. So we have something called Speech Bundle now, which we just launched today. And that's what I want to talk about is these 4 supplements that get the most language out of my kids that I work with. All right, and we're gonna walk through the scientific research behind it, why you wanna do it, and talk about this protocol, which is all lined out for you on that page of our Speech Bundle. Okay, so you can always go to Speech Bundle if you want to. All right, so the way we bring about language with a lot of our kids is by making sure the brain is working as it should be. And the brain works on different chemicals. Just like our car uses gas and oil and antifreeze, our brain works on different chemicals as well. And we want to make sure that those brain chemical levels are where they should be. So let me walk you through the 4 supplements that are in our new Speech Bundle. And these are the supplements that I work with our kids, and we've just kind of put them together and protocolized them, if that's a word, protocolized, for you guys to try. And I'm going to show you the supplements, going to show you the research, and kind of talk about some stories of my kids. So the first thing that we need to do with the brain is make sure that it has enough serotonin. Now, serotonin is a chemical in the brain that makes you happy and helps you sleep, and also provides language support, all right? So we wanna make sure our serotonin levels are good because, let me get my cheaters, because I've been wearing these more often. The research study shows that there are developmental disruptions of serotonin that may be involved with autism. In fact, hyposerotonemia, which is a fancy name for low serotonin, affects development of sensory and motor and cognitive functions. We have another research study that talks about how dysfunction of brain serotonin system development is hypothesized to contribute to autistic behaviors. Again, this is an old study back from 2004, 15 years ago. They were thinking about it. Now we know it's true, okay? Here's another one called serotonin system that talks about how reduction of central nervous system serotonin, which can be caused by low tryptophan in the diet, causes a worsening of your STEM behaviors, your stereotype behaviors. And it can also, when we boost serotonin, have a reduction of those ritualistic behaviors and aggression, okay? So just a few research studies, but there are plenty that show serotonin has a key role in how autism symptoms are produced. So we want to make sure that serotonin levels are good and high. Those are easy to do naturally with supplements because guess what? We are what we eat, and even the chemicals in our brain are made from foods. They're made from protein and certain vitamins. So we start with our supplement, Super Serotonin Support. Okay, these are tablets of a protein, 5-HTP, that's going to boost serotonin levels in your brain. Now, what I want you to do, and this is highlighted on our website, start with 1 tablet. And then every day add another one until you get to 5 tablets, all right? Use the dose that works best for your child because the right dose of these supplements that increase serotonin should help with behavior, sleep, and language. Now, if your child, I hear this a lot. I hear people say, well, my child sleeps well, so I really don't need it. That's not the case. Just because you have enough serotonin for sleep doesn't mean you have enough serotonin for language, all right? So start to slowly increase the super serotonin supplement and find the dose that works best for your child. That's gonna be the first step. Now, let me have a side caveat here. If any of these supplements that affect the brain and language cause a side effect, then just stop, okay? Nothing is for everyone, and that's key, and that's clutch to working with kids with autism. Nothing works for everyone. So try it, see how it works, because I would say the main symptom that I see when there's a side effect is sadness and weepiness. Kids will cry and cry and cry, or maybe tiredness, okay? So try that. Somebody asked really quickly, how big are the tablets? They're very tiny. They're about the size of a pencil eraser, and they're very soft. So you could just squish them in your hands. They're not like hard tablets. So that's step 1. Let's boost the serotonin. Okay. Step 2, what we want to add on is folinic acid. Okay, now folinic acid, we've been talking about for a long time with language because it's extremely effective for many kids in boosting language. So again, here's some research studies. Folinic acid improves verbal communication in kids with autism. This says folinic acid for 12 weeks resulted in improvements in verbal communication. Here's another one that talks about folinic acid improves the scores of autism in communication, social interaction, and significantly improved at week 12 compared to baseline. This says 12 weeks of them is 12 weeks of folinic acid really going to help with language. And here's our final study on this. Folinic acid as an adjunctive treatment in therapy for autism showed significant effect for speech and stimming, which is stereotype behavior, as well as for hyperactivity and non-compliance. I'm sure my wife would be happy if I took something for non-compliance as well. So folinic acid, again, folinic acid isn't new, all right? You may already be using it as the pharmaceutical leucovorin, but last year we developed what I believe is a much better type of folinic acid delivery system, because this is our product, Super Folinic Acid, and we've paired it with other supplements that help with the absorption from the intestines to the bloodstream and help with the absorption across the blood-brain barrier. So our Super Folinic Acid seems to be working much, much better, and we're hearing great results from a lot of people about language improvement with our folinic acid. So that's the second thing to do. Now, you're going to start small with that, like 1/8 of a teaspoon, and you can slowly increase, see what happens. But again, give the dose that works best for your child. Too much folinic acid is going to cause hyperactivity and sleep problems, so you want to adjust the dose on what works best for your kid, okay? The next thing is dopamine. So dopamine is another brain chemical that can help with language a lot. I tend to see it work better in females than males. I find that the serotonin treatments work better in males than females, and the dopamine works better in females than males, but I want you to try it with all your kids anyway, just because the effects can be great. So again, here's some more research behind that. And actually, there's not a whole lot of research on dopamine and autism. This is the only study I could find that the dopamine hypothesis of autism says that providing dopamine modulators to autistic subjects should lead to a behavioral improvement. So just because the research hasn't been done doesn't mean we don't see it clinically, all right? So clinically, we see the dopamine supplements work really well in producing language, helping with focus, helping with concentration. So again, this is our dopamine supplement. It's called Attention on the Double. And again, you start slow, you work it up. If there's side effects, which would mostly be hyperactivity or insomnia, then you back down or you stop it completely, all right? The last thing we're gonna do is use another supplement that's an anti-inflammatory. What we wanna do is decrease neuroinflammation. decrease inflammation in the brain. And this has been another supplement of ours that has worked well in a certain groups of kids. They take this anti-inflammatory and all of a sudden, boom, the language just starts coming out, which is cool. So our neuro anti-inflammatory is called Panda Bear, okay? Now we named it this because anybody who has pandas or PANS should be on anti-inflammatories, but you don't have to have pandas to take Panda Bear, all right? It's a natural anti-inflammatory, and the active ingredient is called PEA, which stands for palmitoylethanolamide. These chemicals just roll off the tongue, don't they? So here again, more research studies. Palmitoylethanolamide is an adjunctive treatment for autism, helped with inappropriate speech. Now, what's interesting about this particular study is they combined PEA with a drug called risperidone. All right, so they compared risperidone and the PEA with just risperidone, and they found the risperidone and the PEA worked for the language where just the risperidone alone didn't. Okay, so that's helpful. This is another one, palmitoylethanolamide, neuroinflammatory effects. PEA possesses a powerful neuroprotective and anti-inflammatory power. So we know it's working as a anti-inflammatory. Here's another one. Palmitoylethanolamide counteracts autistic-like behaviors in autistic mice, demonstrated a therapeutic potential of PEA in limiting autistic symptoms, supporting neuroprotection, anti-inflammatory effects, and modulating the gut-brain axis. Okay. Last research study, I don't want to bore you with all this science, beneficial effects of palmitoylethanolamide on expressive language, cognition, and behaviors in autism. We know this stuff works, and again, ours is a nice flavorless powder, which is great because you can just kind of put that into some kind of food. So these are what work best for our kids. Okay, so that's what I want to kind of guide you guys through is what we can do that helps my kids in my office with language. And some things work for some kids, other things work for other kids, but this is what helps the majority of my kids with their language, which is pretty cool. Now, this is the time to talk about, we've got a 30-day return policy. So you grab the speech bundle, you try stuff, some of it doesn't work, all of it doesn't work. You can send anything back you want for a refund within 30 days, okay? One of the supplements doesn't work, send that back. They all don't work, send them all back, all right? We want you to try what works for your kids. So that is, I think, the quick down and dirty of our new speech bundle. And again, we're just bundling supplements that we've normally used together, to help kids with language, but we wanted to put it in kind of a protocol package for you. So the actual protocol is on our website. We already have pinned our speech bundle link, so you can go there, click speech bundle, or click the link, it'll go to speech bundle, and the protocol's there and kind of walk you through everything. So I hope this is something that you guys can try to really start to get some language out of your kids. And I think another important thing to talk about is how fast should this happen, okay? Now speech is a progression. We learn speech by imitating and mimicking. Okay, so it's about, when you have a young kid, they're gonna look at you and imitate mama, dada, mama, dada. That's why the first thing that kids do is repeat, all right, which we call echolalia. They're just repeating and repeating and repeating. The next thing for language that's developed is scripting. So they hear a group of words, and that group of words is associated with an emotion or with a certain time you're supposed to say something, okay? So I say, hi, how are you? And you say, good, how are you? And then it's just a script that we all have unconsciously. So, and then the next step from there is conversational language. So as you're watching your child develop their language, it's going to go from mimicking and repeating to scripting, groups of words, and then to conversational language. And then kind of another layer on that is receptive language. The receptive language is what they hear, what they understand, and how they respond. So when you have a child with good receptive language, the expressive language is ready to come out because they understand the words, they understand the language, they can respond to you in the appropriate way. Good receptive language is a good sign that expressive language is next.